Good morning and welcome to Living Local 15. I'm your host, Jessica Williams. Thank you so much for joining me today. It's time to grab a cup of joe and enjoy the show. We are kicking things off with IU Health and learning how they are creating a presence in our community to bring awareness to hypertension and cardiovascular disease. From barbershops to local events, they are here to educate and to spread the word. Then it's time for Mental Health Matters with Viking Psychiatry. And today we are discussing medication overuse and how that can impact your mental health. That and more happening now.
Fashion, food, and fun. You're watching Living Local 15 with your host, Jessica Williams.
This segment sponsored by Indiana University Health. Indiana University Health is a nonprofit healthcare system and has so many physicians and APPs who are currently accepting new patients. And here to tell us all about their community outreach is Nia Hinton, Community Health Specialist, and Jennifer Robbins, Quality Performance Improvement. Hello.
Hi.
Welcome.
Thank you.
Yes. Okay. So I would love to learn more just about the current initiatives that IU Health has when it comes to trying to reach unserved populations. Nia?
Yes. So our main goal in being out in the community and doing the community outreach is to kind of go over, feel the need for the hypertension that's going on in our community, in the Black and brown community more specifically. So by doing that, I'm out, boots on the ground, in the field, out in the barbershops is kind of where we're at now. I'm in barbershops, 2 of them specifically. I'm at Magnificent Cuts, barbershop, and also Above Average. And we picked the barbershops because we feel like that's a good community.
Right.
Like, you see all types of people coming into the barbershop. I've seen and been able to meet all types of people by being in the barbershop. So by doing that, when I'm in there, I'm doing blood pressures. I'm building relationships with the people that are in there. I'm seeing what other needs they have, not just focusing on the health, but also seeing what other needs they may have. Because when you are worried about food, housing, utilities, it's so hard to focus on your health.
Absolutely.
So I try to tackle it all.
And so why is hypertension such a main focus with your current outreach?
That was our big goal over last year. In the quality field, we were looking very specifically at hypertension and the disparity, meaning we were looking at various populations. And what I noticed with our data in the Fort Wayne area is our African American population was so much lower in meeting the hypertension goals. So I really wanted to build a program where we could do outreach and meet people where they were in the community. Barbershops have a special place in my heart. My son is a barber, so I met Nia by chance at an event, and we really connected. I was sharing my ideas, and she already had an in the community doing some of this work, and so it was really just a great partnership that kind of melded together very quickly.
Right. And can you explain hypertension in case people are not aware?
Sure. Hypertension is high blood pressure. And what we're looking at specifically with hypertension is a number over 140 over 90. And what that means is your blood pressure's high. It could be a lot of factors relating to that. And we know in specific communities, they have higher stress levels. And so that's something we really wanted to address. We also know that it can have long-term effects. If it's not addressed and kept in check, that can lead to long-term effects later in life. So we really definitely wanted to make sure we were addressing them with the population, especially those maybe that are a little bit younger that might be just starting in this journey with hypertension.
Interesting. And so Nia, do you feel that the hypertension has to do with it being greater in the African American community, or they have less access to getting help or seeing or prevention for that particular disease?
I think both, to be honest. And I say both because being a Black woman, there are certain pressures and certain burdens that we have that other cultures don't.
Right.
So I think that that's the issue in and of itself. And then healthcare being not as accessible to us, yes, that is true too, especially in certain areas, because transportation, not having a bus stop to transport or not even having a vehicle to get there, lack of community, and also lack of trust in healthcare.
Right.
That plays a major part in it for me, because a lot of people that I do talk to and encounter, they're like, I went to the doctor, I told them I had this going on, they downplayed it. So why should I go back? So when I'm in the community, my main goal is to rewrite the narrative for them. Show them that, yes, I am part of IU Health, but I see you, I understand, I can relate to you, and we can get this done together.
Yeah.
I want to be the change that I want to see in my community.
Yeah, I love that. And as you do these events and get more connected in the community, how have you seen the response and reaction?
I feel like it's been great. There have been, I've built a lot of trust with people. I have a lot of returnees, people that may not even be getting their haircut that day, but they want to come back in. They know that I'm in there, or they're excited to let me know, hey, I'm checking my blood pressure every day. I've switched up how I'm eating. I've become more active. So they're really excited to have someone who they feel like genuinely cares. They're like, oh, I know she genuinely cares. She's here. She's still here. She's coming back. I'm talking to them. I'm getting to know them. I'm building relationships. And I'm being very inclusive. And that was a big part for me. I want to be inclusive. And by me building that trust, it allows them to see that, okay, you know what? I know what I experienced before, maybe by going to a doctor or things like that, but I'm willing to go ahead and try it again. I'm willing to try it again. So that's my main goal for me. Because like I always say, you know, black men and women are dying at alarming rates due to hypertension and cardiovascular disease.
Right.
So I'll just explain to them that they go hand in hand. So we just want to make sure that we're tackling those issues head on.
And education is so important.
Absolutely.
And so Jennifer, why is it important for IU Health to really have this community-centric vision? And in what ways do you all plan to expand that vision?
There are so many opportunities, and that's one of the things that I really saw when I started looking at the data. We knew there was opportunity there. We also are new to the community, and we really wanted to share our vision about partnering with our community, whatever means that is. So if we have to go out into the community to do that, which really is the best method, then we're going to do that. And we're going to do whatever it takes to build trust, to let people know that we're here and we're not leaving, and we want to be your trusted partner. I think we have lots of opportunity to expand. This barbershop idea has really blossomed into a lot of other ideas and other ways that we can utilize that space, which is a great, it's a great space where people already feel comfortable and safe. And so having those partnerships allows us to come in and automatically have that safety net and that support. So we have those great gentlemen that are supporting us in the background and building that support connection and that bridge for us. So it's been a really great opportunity, and we know that there's room for expansion on that.
Yeah, absolutely, because you are, like you said, building those relationships, coming back, being consistent, and actually bringing the health and education to them. But in reverse, people can also visit your facility, right? If they feel at any need that they need to come in to see a physician. I know that you have a lot of new and available physicians that can that are open and willing to help them in office too as well.
Yes, we do.
Yes.
We have 4 offices currently that are primary care. Lots of new physicians coming in, lots of opportunity for expansion and growth in the future. As our hospital is being built, and I'm sure all of you have seen that off of 69, we're really excited about that. We're getting even more excitement and more opportunities for the growth within primary care. So improving that access is our main goal.
Absolutely.
Yeah, I love it. Well, thank you both so much for coming in and
so
chatting
much,
with
Jessica.
me. And keep going. I love what you're doing in the community.
Thank you so much.
Thank you.
And if you would like more information about IU Health, we'll have their website listed below. Remember, they have multiple locations that you can go and visit them. And I'll see you after the break. This segment sponsored by Indiana University Health.
Follow us on social media at Living Local 15.
This segment sponsored by Viking Psychiatry. Welcome back to Mental Health Matters with Viking Psychiatry, and today we're going to be discussing the rising concern of medication overuse in mental health, and here to share all about it is Sean Goddard, owner of Viking Psychiatry. Hi, Sean.
Hi.
Welcome back.
Thank you.
Okay, I always love chatting with you because you bring some really interesting information to the table, and it's so informative. And so today we're going to talk about medication use. And when people think about it, number one, how is medication used in mental health, and why is there an overuse happening?
Yeah, I think it's really a combination of things, right? Medication is being prescribed to help with sleep because so many people struggle with sleeping correctly, right? Going to sleep, staying asleep, shutting their brains off, depression, anxiety, right? There's so many different things going on in mental health and so many different medications that are available out there, which can be very beneficial in the right situation, right? But I think you have a combination of, sometimes I tell people we're kind of a little bit of a Burger King society. We want things our ways right away, right? And regretfully, mental health is not something that often can be just fixed overnight. It takes work and time, right? But we don't have that time a lot of times to commit, or feel like we don't have the time. And so the hope is that a medication, a pill, will be able to fix it and resolve it all. On top of that, we also deal with a medical environment that is really just revenue-based, right? It's about the numbers, and reimbursement from insurance companies are getting worse and worse. And it's not about being able to spend time and sit and spend time with a client. Instead, it's about making sure that you stay in the green. And to be able to do that, you have to see more and more and more clients. And so that provides less and less and less time to actually sit and have a conversation with somebody. And so what that often leads to is minutes of conversation and then an immediate prescription, right? And often very little time talking about that prescription. There should be informed consent where you're being educated about the medication, the potential side effects, the risks, the benefits. But far too often that prescription is just being handed out and say, take this. And so I think it's a combination of all of those things combined that have led to a significant rise of not only medication use, but instead of individuals being on one medication, now they're on two, now they're on three, now they're on five, right? So we see what we call polypharmacy and the interactions that it can occur by being on so many different medications.
Yeah, and you talk about it being revenue driven in a way. I mean, these pharmaceutical companies are really making a lot of money. They're really pushing their product. And people can gain a level of dependency on those products, unfortunately. And so how can someone recognize if they are dependent on a drug or if they are overusing medications that's meant to help them?
Yeah, one of the things that we look for is when people decide to change dosing on their own, right? So if I've prescribed you a medication and I ask you to take this certain milligram and take it once a day, and you decide, well, on your own with no conversation with your provider, that, it helps, but I think it's going to help me more if I take it twice a day or 3 times a day, and you start doing that without speaking to your medical provider to do that sometimes can be a sign of dependence or misunderstanding. There's a lot that can go along with that. As well, if the medication has helped and you've had a significant improvement, and then your provider says, okay, I want to begin reducing this medication, and you immediately, your response is, no, why? We can't do that, right? And even though that, when a client comes to me, sometimes when clients come to me, they say, well, if you're going to prescribe me this medication, do I have to be on it forever? That's the fear, right? And so instead we have a conversation about what treatment looks like, and when we get to a certain point of stability, we're going to start reducing it to see if we can get you off of it. And most people want to begin that reduction, right, and see if they can do well without the medication. But when there's a sudden knee-jerk response of, oh no, I can't do that, I need this, I have to have this to be able to do well, there can definitely, it might not be so much of a physical dependence, but instead a psychological dependence on that medication. Those are some of the signs that we look for.
Yeah, that's so interesting. And I think about what you said at the beginning about having options through time. You know, the more time that you have, you can explore more options. And I think that people do not take the time because sometimes medicine or treatment in that way just seems like an easier thing. You know, you and I have discussed a lot. I'll just, share about myself. You know, I have sleeping problems. You know, I have insomnia. And so I will take a sleeping pill. But I think that you have methods to really go deeper into the brain therapy and to really understand what is the underlying issue and then treat holistically through that. And so let's talk about those alternatives and how if someone is suffering from stress, depression, or anxiety, there are alternatives through your treatments.
Yeah, so, sometimes people feel like when we talk about these alternatives, we're beating a dead horse, right? Like I can talk to you about therapy and the benefits of therapy, and I can talk to you about, if you're not having a sleep issue, the help of ensuring you're getting the proper amount of sleep, right? I can talk to you about vitamins and tracking hormone levels and checking the thyroid and doing all of these types of things. Those all can be extremely beneficial, but sometimes it can be very hard to follow those steps. The other side of it is sometimes we're just treating the wrong thing, right? Like using your example where you discuss having difficulty with going to sleep and you're taking a sleeping medication. I can't tell you how many times that I've had somebody who has been diagnosed with a sleeping insomnia, prescribed a medication to help them go to sleep, but the problem isn't necessarily the sleep issue, it's the underlying anxiety or the underlying ADHD that is not allowing our brain to shut off so that they can go to sleep.
Right.
And instead of properly going to the root and finding what the issue is, the answer was, oh, you're complaining of sleep problems? Well, here's a sleeping pill to help you go to sleep. When sometimes the time needs to be spent to see what that underlying issue is and addressing that opposed to just what we call slapping a Band-Aid on it by prescribing a pill for sleep.
Yeah. It's so funny because, it is like that constant brain work at night, and it's like not being able to, shut it off. And I will like lay down, and maybe it's anxiety to sleep. It's so weird. It's like I hate to go to sleep and I hate to wake up. It's like once I'm asleep, I'm like, oh, let me stay asleep. So that's good, though. That's good. Understanding the underlying issues. And then back to the discussion, though, of the medication overuse. How can someone really approach this conversation with their medical provider just to make sure that they are not overusing or doing some of the things that you mentioned, which is absolutely horrible if someone's doubling their medicine or trying to self-diagnose?
Yeah, we really have to advocate for ourselves even more and more. As a nurse, when I went through school initially as a nurse, one of the things we're taught is advocating for our patients, right? Being the voice for our patients. But regretfully, in the system that we're at now, there isn't a lot of advocating going on because there isn't time for advocating. That nurse that you see, you're with them just for a minute or two before you're in and you're seeing the provider, right? And so we really have to advocate for ourselves nowadays. And so if you're walking into an appointment and you have these concerns and you also know that this is an appointment that's typically rushed, you can do a couple of things. One, you can call ahead for your appointment and have it marked down on the appointment that this is an issue you wish to discuss.
Yeah.
And then I also recommend bringing your questions in, having them pre-written down, because how many times do we walk into a room with all these intentions, but once we're put in that spot and other questions are being asked, and then all of a sudden we forget what we were going to talk about or the concerns we had, right? And so, and being able to say, this is my concern is so important, and advocating for yourself for that.
Yeah.
So you can do little things to set yourself up for that. And maybe you also need to make sure that they book more time for you, right? And so by calling ahead and doing that question and saying, is my appointment going to give me time to be able to talk to my provider about this concern, or do I need to reschedule my appointment to where you guys can give me more time allotted to my provider so that we can have that conversation because it's important to me. So.
Yeah, and it's really all right, because if we're making an appointment and we're paying for the appointment and we're paying for the deductible, it's like we should get the services that we
Absolutely.
need. And just one thing I would add is not to be intimidated by the doctor. Like, by being a self-advocate, that doesn't mean that you just have to be quiet and sit there. It's okay to say, wait, could you slow down? Could you explain this to me? I have these concerns. Would you mind addressing it? Because I've experienced doctors that will just like speed talk and just want to check. And I'm like, hold up.
Right.
And it's okay to say that because, they are the professional and you need their medical attention from them.
Sometimes we're seeing people and we're seeing those individuals just because we felt like that was our only option, or that's who my mom saw, right?
Yeah.
Or my sister referred me here, right? Just because somebody else has a good experience doesn't mean that you're going to have a good experience. And things have changed over time. So if you have a provider that you're seeing and you're feeling that you're not being heard, or they're not willing to take the time to hear you, then maybe it's time to find somebody who will, because that's important. That's what we're there for when we're caring for individuals. And sometimes providers need to be reminded of that, I understand that you're busy. I understand you have all these clients to see, but right now I'm the client and I'm in front of you and I have these issues and I need them addressed. And if they're not willing to address them or educate you and teach you and walk you through your concerns, then maybe it's time to find somebody who will.
Absolutely. I love that. I love that as a provider, that's front of mind and you practice what you preach. So thank you so much,
Thank
Sean.
you.
And if you would like more information about Viking Psychiatry, we'll have their website listed below. And I'll see you after the break. This segment sponsored by Viking Psychiatry.
Living Local 15, proudly driven by the Kelly Automotive Group.
Thank you so much for tuning in today. I hope you enjoyed the show. And remember, you can always catch up on episodes and segments of Living Local 15 by going to WANE.com, downloading the WANE app, and also checking us out on YouTube. And I'll leave you with this. It's never too late to live your best life, so start living it today. And I look forward to seeing you here tomorrow. Bye-bye.
Content segments during today's Living Local 15 were paid for by these sponsors.